So my name is Jochen Binder Dietrich. I'm the consultant psychiatrist with the Bristol Early Intervention Service. As a consultant psychiatrist, I'm the doctor or the psychiatrist with the service. The team is a multidisciplinary team, so we have most of the professions represented within the team. That includes social workers, nurses, and psychologists, and myself as the psychiatrist. There is one more psychiatrist who works with us 3 days a week. She's a specialist grade doctor, and my role is partially a specific role, so a psychiatric role looking at diagnosis but also treatment, obviously. I usually get involved with the more complex service users who have more complex needs where the diagnosis might be uncertain. But I also provide quite a generic role, so I take on the clinical leadership of the service part of the time, especially when clients pose risks either to themselves or others, or have other complex issues. Yeah, the Early Intervention for Psychosis Service is a service that was specifically developed for young people who suffer a first episode of psychosis. Now, psychosis can mean many things, but it's usually young people who present with either suffering from delusions and having experiences which the people around them do not experience. So that can be having delusional thoughts about certain things, quite often paranoid ideas, and also quite frequently we see young people with psychosis who suffer what we call hallucinations, so hearing things, seeing things or feeling things, smelling things, tasting things that aren't actually there, but most frequently hearing voices. So often it's a combination of people who hear voices and at the same time also have delusional thought contents. Now that in itself is a syndrome, so a set of symptoms that occur together. That doesn't necessarily explain the cause of those symptoms, so that those can be very varied. Quite often it's a mix of having a certain maybe genetic disposition or a family history, but also that then combined with trauma, with difficult life events. Sometimes a factor can also be the use of illegal drugs or cannabis especially. So quite often there are many factors leading to what we call a psychotic episode. And the age range we take people on is between 16 and at the moment 35. We will be going to a higher age, we hope soon, but at the moment it's young people who suffer a first episode of psychosis between the age of 16 and 35 that we would assess for our service. We do work jointly with CAMS, that's the Child and Adolescent Mental Health Services, for the age groups between 14 and 16, but we only take on sole responsibility for service users that are 16 or over. Well, the majority of the young people that we see come through their GPs, so that's usually the first port of call, that their family or they themselves would go to the GP and express their concerns, and the GP would then make a referral to mental health services in general in Bristol. And if the referral already states symptoms associated with psychosis, that referral would then come through to us and we would be part of that assessment process. And in the assessment, which usually takes about an hour, the first time we meet somebody, we will be talking about what they're experiencing at the moment, when did this begin, how did it begin, how did it develop, and then we would go away and think about whether we would be able to offer that person a service, and they would get to know whether we can offer a service within 24 hours normally. Now, sometimes when we're unsure whether the person is suffering psychosis, what we sometimes agree to is that we'll have an extended assessment period. So we might actually see somebody over a period of 6 months maybe, and meet up regularly and see how those symptoms may develop or crystallize over that period of time, and then make a decision whether our service is the right service. I mean, obviously the service user has a say in that as well. We tend to work in collaboration with the service user. Also, at this point, I'd like to mention how important the family is of the service user, and family and or carers. Quite often with our younger clientele, it's the parents that get involved. And we try and work very closely with the family and the carers to help us understand what the problem is, because obviously parents and carers know the service user much better than we do. And it's quite important often to get what we call a collateral history, so we get a history of what's been going on for that person from a family member or carer as well. So we try and involve the family and carers as early as possible, and then work collaboratively with the family carers and the service user to come to an understanding of what's been going on, to come to a formulation or diagnosis. We tend to be, again, do that in collaboration. We don't just label somebody with a diagnosis of psychosis, or the term schizophrenia, something we rarely use, although that can happen later on. But in general, we come to some form of agreement between carers, service user, and us to what we call the disorder that the person is suffering. Yeah. Well, I've always, in my career, what I enjoy most is actually seeing service users and spending time with service users and their families. When I see clients during the day or their family, that gives me a sense of satisfaction at the end of the day. Yeah. Yeah, I think the two words are already there, early and intervention. And I think the third word would probably be support. Early meaning that there's clear evidence that the earlier we intervene, although intervention very much sounds like we do things to people, obviously we try and work in collaboration, as I've pointed out. So there is clear evidence that the earlier we intervene, and the family together with the service user, we intervene, provide care, support and treatment if somebody does present with psychosis, the better the outcome. And the outcome means the duration of being severely unwell or being unwell is limited. Obviously, the earlier we can support somebody and treat somebody, the sooner they will become better. But also there is evidence that obviously being unwell for a prolonged period of time, that the disorder can become worse over time. And especially because this is such a vulnerable time in somebody's life where people are still in education or they're just about to become independent, they're about to leave home, that obviously for someone's development, becoming unwell at such a critical stage can have a huge impact on their ongoing life. So it's very important to minimize the effects of a disorder or a period of being unwell during this very crucial time in somebody's life. So I think that's important. So the early intervention and support, I think both the service users and obviously the families and carers need support, because not only does the service user frequently suffer from having a psychosis, but also do the carers and family. It has a huge impact on them. Very often it comes as a huge surprise. It takes quite a while to adjust, to understand, to maybe reorientate what can the expectations be of their child, of their loved one, and so on and so forth. So it can be a very, very difficult time, not just for the service user, but also for the family and carers. So I think we do offer support there as well. We offer a carers group, which runs several times a year, where the multi-professional team provides evenings which are mainly educational but also supportive, and there's a lot of room for discussion and questions and hopefully answers from our behalf in those carer groups. Yeah. Well, personally, I would say about 50-50. I see about half of the appointments I have is probably at Colston Fort, which is our team base, which is based in Cottam, just up behind the BRI on the hill. So some service users prefer that. They want to come to that neutral space, which is not their home, to see us professionals. But a lot of our service users would be probably overwhelmed by making that trip, or they find it more comfortable to see us in their home. So I would spend half my time seeing people in their own home, but it doesn't always need to be the home. Sometimes it's a community base, be it at their GP surgery or at social services or any other community base. We're very flexible. We try obviously to meet our service users' needs, and where they feel comfortable to see us, we will try and see them.